Hello and welcome to Health Matters. I am Mary Alale Yusuf. According to the World Health Organization, oral health is the state of being free from chronic mouth and facial pain, oral and throat cancer, oral sores, birth defects such as cleft lip and palate, gum disease, tooth decay, and tooth loss, and other diseases and disorders that affect the oral cavity. Among children, 60 to 90% have dental cavities, and the figure rises to almost 100% in adults. Now get this, about 30% of adults between 65 and 74 years have no natural teeth. Today we are discussing general oral care for oral health, and to do this with me is Dr. Kehinde Umezudike. She's a lecturer and consultant periodontologist in the Department of Preventive Dentistry, College of Medicine, University of Lagos, Idi-Araba. You're welcome to the show, Dr. Umezudike.
Thank you.
That was a mouthful, tooth decay, facial pain, blah, blah, and all that. Was that a complete definition of oral health?
Yes, you're right. It's a complete definition.
That's pretty extensive.
It is extensive because oral health actually has been defined as it's been said to be a state where one is free of pain from any condition, pathological condition that could affect the oral tissues, including the hard tissues and the soft tissues. So I believe that definition was
pretty
quite
well covers it.
encompassing.
Okay, now I'm really interested today in how we can keep our, have general oral hygiene, which I guess would be key to having oral health.
Yes.
So let's start by looking at our little array here. How do we brush our teeth?
Okay.
Teach us.
Okay, thank you. First of all, there are different methods, but the preferred methods are the roll technique and also the bus technique. Okay. Now, one of them, for instance, the roll technique is actually for people that have diseased gums, and most people fall under that category. While the second technique, which is the bus technique, is actually for those that have healthy gums and who do not have sensitive teeth. And I will demonstrate those.
Yeah, let's do that right away.
This is a model, and this is just...
This is not the size of toothbrush.
This is not the size, no. Just an example. This is actually an ideal toothbrush, But the texture actually should be of medium texture or soft texture. And also it should be of nylon bristles. Nylon.
What other types do they have?
At times we have some that are natural, made of natural filaments.
Okay, so nylon is better?
It's better.
Okay.
Now, what we also advise is that when you're going to brush your teeth, by the way, it should be twice in a day, you should open your mouth slightly, and then you take the toothbrush. For the roll technique, what you do is that you place the bristles on the gum. For the teeth that are up, it lies on the gum, facing upward, and then you gently roll down.
Okay. I actually call this straight. So now you're correcting me. This is the roll technique.
Yes, the roll.
From up to down.
Up to down, and then you roll down like that.
Okay.
Up to down, then you roll, like a wrist roll techniques. So you give different strokes to different segments, up to maybe 4 or 5 strokes, and then like this, like this.
Okay, how about under? Back of the teeth here.
Yes, the same thing. With your mouth slightly open, you also place the brush facing up.
And then do it from inside as well. From inside.
For the front ones, you have to make it vertical.
Yes.
And then you brush downward. The important is that all the upper teeth, you brush them downwards. And for the ones that are down,
you
your
take
bristles, you take it up like this.
So how about the other technique?
The other technique is the bus technique.
Sorry, which one is for the diseased gums?
The diseased gum is the roll technique, because the bristles are not going inside the gums. Okay. They are just online.
You're trying to favor the gums because they are delicate.
They are delicate. Okay. You are massaging, as it were, and bringing out the plaque deposits.
So the one for healthy teeth now, the bus.
Yes. Now, for the bus technique, you angulate the brush. That's why I said it's a bit technical. Maybe estimate about 45 degrees. So that's an angle.
Let's do that facing the camera.
Okay, so at an angle of about 45 degrees, with the bristles well placed inside the gum, slightly inside the gum, and then you make short back and forth movements. Okay. Short back and forth, and then downward.
Then you now do the roll thing.
In a way.
So it's like a combination of...
In a way. in a way. But the important thing is that we must distinguish this technique from the horizontal.
Yes, you know there's the temptation to just do the thing right across the teeth. Is that wrong?
It's wrong. It could be wrong in a way. It could be faulty, let's put it this way, because it could cause some damage to the teeth surfaces as well as the gum surfaces. It could cause some tooth wear at the neck of the teeth, and also the gum, causing longer teeth and causing root exposure because it thins out the gum.
Okay.
So we don't really encourage that, even though that's what a number of people do.
That's the natural thing to do.
Because
really.
of time.
And you know, just the surface, just go across the surface.
Exactly.
So we shouldn't really do that. Go right across the teeth. Sorry, let me demonstrate like
Yes,
this.
please.
This is what most people do.
Yes.
You know, after
Yes.
doing that, they just go ahead and go right across.
No, we discourage
That's wrong.
that. It's a scrub method. And also, you don't forget to also brush the surfaces of your teeth, like that. Also, the biting surfaces, the chewing.
Do we do anything with the toothbrush on the tongue?
Yes.
So
yes.
show us.
You gently, you know, brush the tongue, especially the back. We take care so you don't
and then you try and cover every surface if possible.
And of course, with the toothbrush, you need to put a fluoride, use a fluoride-containing toothpaste, which is important.
Now, how about floss? What is this floss?
Thank you. Well, floss is an example of an interdental cleaning aid that is used to basically remove plaque deposits and food debris from in between the teeth surfaces, because the toothbrush cannot actually have enough access to those areas
between the teeth.
So we need to use dental floss. It's actually recommended
every day,
at least once in a day, preferably after brushing in the morning, or at night, or at your convenience.
Can you show us some floss?
Okay, we have some examples here. This is an example of a
so
floss.
you cut a bit out,
yes,
which we throw away later.
Yes, as soon as you finish using it, you cut about 18 inches, or you just estimate something long enough, maybe a meter rule, and then it has a blade within it.
Oh, to cut it. How convenient.
Very.
Okay.